So hi everyone, a pleasant day today, and sorry I couldn't give the test explanations yesterday. So I am ready now to give the test with you. 3, 2, 1. Let's see the first question. Okay, many people have made a mistake like this. See, whenever you hear a penetrating injury, you jump onto sympathetic ophthalmia because that was asked in the previous exam. Sympathetic ophthalmia is due to penetrating injury, yes. But for example, if the one eye has penetrating injury, that will not have sympathetic. That will be having granulomatous panuveitis due to trauma. The other eye gets type 4 hypersensitivity reaction, and the uveitis which is in the fellow other eye, that is sympathy, that is sympathetic ophthalmia, that is a sympathizing eye. Here after penetrating injury, vestibular matter, restricted eye movements, pain, vision loss, no light perception, corneal infiltrates means what? That cornea was involved, and restricted eye movements means that sclera might be involved because extraocular muscles are attached at the sclera. So this is not sympathetic ophthalmia. This is panophthalmitis because all the layers of the eyeball are involved, involving the outer fibrous layer. That is the answer of first question. Endophthalmitis means the inner layers are involved, outer layers are spared. That is not in the and panuveitis. See, there is a outer in panuveitis, the cornea sclera are not involved. Like sympathetic ophthalmia is an example of panuveitis. But cornea sclera are not involved. Like there is no corneal infiltrates in sympathetic ophthalmia panuveitis, and sympathetic ophthalmia is not in the question itself. Many people have answered this question. Don't just cram that penetrating injury sympathetic ophthalmia. No, one eye penetrating injury, the other eye gets type 4 hypersensitive reaction. That is sympathetic ophthalmia. Intravenous steroid is a treatment of that nowadays to save the other eye as well. So the first question is panophthalmitis. Now, what you people make mistake. Now, if there is a no, for example, if there is a sympathetic ophthalmia question, one eye has having sympathetic ophthalmia due to penetrating injury in the other eye. So there is no vision in the penetrating injury eye, and the other eye, the symptoms have not started in the sympathetic ophthalmia. Now you can take out the penetrating eye, penetrating trauma eye, exciting eye, so that the inflammation is not started in the other eye. Otherwise, if there is a vision in the sympathizing, if there is a vision in the exciting eye, you have to save the exciting eye. You have to save the traumatic eye as well. Then intravenous steroid is giving the treatment, is the treatment. And what is the first symptom which you get in sympathizing eye? Loss of accommodation, loss of near vision. So, for example, if there is a penetrating trauma in one eye and there is no vision in that eye, and the other eye already the loss of near vision has started. Now also there is no indication of taking out the exciting eye. Then also intravenous steroid is a treatment. So that's the first question. Now second is a question. Flare is the presence of proteins. You should know this. Presence of proteins in the vitreous or aqueous, that is known as flare. Usually it happens due to blood aqueous barrier broken down. Blood is vitreous hemorrhage. Blood in the aqueous is hyphema. So any proteins in the aqueous or vitreous is flare. There can be retrolental flare as well. Okay, so patient after accident was brought to the clinic with no perception of light in the left eye. On pupil examination, there was no anisocoria, no difference of pupil size, no reaction of light when shown the light in the left eye. No reaction means this eye, when you throw the light, there is no reaction in both eyes. But when you throw the light in the other eye, both pupils constrict. Means if you throw the light in the right eye, second nerve of the right eye is okay, and third eye of the right eye is okay. Also, the third nerve of the left eye is okay, because it is taking the efferent. So only thing is optic nerve of the left eye. When you throw the light in this eye, optic nerve is cut. That's why it cannot take the impulse. That is left eye optic nerve is the problem over here. This is total afferent pupillary defect. In total, you can't do the swinging light. Total, you throw the light, it will not react at all. Now, if there was a compression of the optic nerve or optic neuritis, then it will be relative afferent pupillary defect, that is Margus-Gunn pupil. When you throw the light in the normal eye, both pupils constrict. When you swing the light in the abnormal side, paradoxically reaction of the both pupils. I can't explain more on this. Answer over here is left optic nerve. Okay. Now this should be an image question, or see HIV patient with this picture having one part of the retina involved, like a pizza pie appearance, having some floaters, decreased vision. HIV, pizza pie appearance, necrosis, hemorrhage means retinitis, and HIV, CMV, retinitis should be the answer. Pizza pie appearance, You eat pizza, sauce and cheese appearance, hemorrhage is sauce, necrosis is cheese. That is pizza pie, sauce and cheese appearance. Answer is cytomegalovirus retinitis. Treatment is systemic plus minus intravitreal GAN cyclovir nowadays. Now all of the following can be seen in cricket ball means blunt trauma, blowout fracture, that is the weakest wall, that is the floor fracture, teardrop sign, separation of iris from periphery, creating an extra D-shaped pupil, polychoria, that is seen. Now chalcosis is due to penetrating trauma. Copper goes inside the eye, that is not seen in blunt trauma. And Berlin edema is the ganglionicular edema causing cherry red spot, that is also seen in blunt trauma. So chalcosis should be the answer over here. Now which is false over here, see very carefully. What happens in dark, room light and bright light? In bright light, what happens? One pupil is constricting but the other is not constricting. Means anisocoria is more in bright light. See the question, anisocoria more in bright light is correct. Right eye is a pathological eye because it is not constricting with light. And diagnosis is right Adie's pupil, yes, because with near it is constricting because accommodation fibers are spared. This is light near dissociation. Right eye is a pathological eye, and isocoria more in bright light. Lesion is not in the pretector, it is in the ciliary ganglion of the right side. And diluted pilocarpine test, if you do in the right eye, it will further constrict because of supersensitivity. So this is your right side Adie's pupil, and isocoria more in bright light. How you differentiate this from third nerve palsy? Third nerve palsy also an isocoria more in bright light, but in third nerve palsy the near reflex is also lost. Here the near reflex is present because of accommodation fibers are spared. And in third nerve palsy there will be down and out eye, there will be squint, ptosis, which is not seen in Adie's pupil. Pretectal nucleus, both pretectal nucleus will have Argel Robertson pupil. That is another example of light near dissociation. Both pupils are smaller, it's a fact, but there is no anisocoria. Now I know the audio already. There was a tuna particle injury, and you have washed eye already. If you have washed eye already, what is the next step to be done? Next step to be done is slit lamp examination to know whether there is a chunk of foreign particles, then you remove them mechanically. All the things are done in chemical injuries, but the first step is copious irrigation with a saline, that was asked in INICT also. Second, you do slit lamp examination to know for the extent of the injury. Sorry. Okay. Then topical steroids are given in early stages to decrease inflammation. Topical citrate and ascorbyl is given to increase the strength of the cornea, and lubricant is also given for symptomatic treatment. So next is slit lamp examination. Now Pancoast tumor with Horner syndrome. Horner syndrome decreases the sympathetic. In Horner's, it is a unilateral decrease in sympathetic supply. Central sympathetic fibers are involved in Wallenberg syndrome, syringomyelia. Then it goes through superior cervical. So before that, lung comes. So apex of the lung tumor is Pancoast tumor that involves preganglionic sympathetic fibers. That's the answer. Postganglionic sympathetic fibers, Horner syndrome, like example, IC aneurysm, cavernous sinus syndrome, and Horner syndrome feature you should know. Pupil is smaller in size, and isocoria more in dark, mild ptosis because of molar muscle, heterochromatitis due to congenital problem, loss of celospinal reflex, and loss of sweating and hydrosis. A person is not able to see from the left side from both eyes, means it is left homonymous heminopia, seen in right optic tract lesions. Can be seen in right occipital lobe lesions, but macular sparing is not written over here. So lesion is behind the chiasma, yes. It is a left homonymous defect. And optic tract, it can be symmetrical, can be asymmetrical, so it can be congruous and congruous. But optic tract is involved in the pupil pathway. So pupil reactions will be abnormal. It will be sluggish pupil reactions in optic tract lesions. And the 10th question, I have given this 10th question, listen very carefully. In the exam, the examiner wants giving you hints to make your questions correct. On routine examination, glass industry labor came for incidental finding, no symptom, vision 6-6, no telltale sign of perforation, visual acuity normal, no complaints. So many things are given that you answer observation. One, you should know it is not a metallic foreign body first. It is a inert foreign bodies. So, and so many hints is given in the question. Vision 6 is glow perforation. Telltale signs, there is no telltale signs. Answer is observation of this. See, in the exam they will give you hints in the question so that you come to the correct answer. So many people have written removal of foreign body in vitrectomy. That is for metallic foreign body. It is inert foreign body, and so many hints are there. Observation should be the answer of this question, and that is the 10 questions. I hope you have done well. You have done well. I know that. I've seen the results. Thank you very much. Best wishes.